Welcome to the NICUToday Podcast, a podcast to give families a new point of support as they navigate the NICU journey. Thank you for listening. Please don't forget to subscribe wherever you enjoy your podcast and share this episode with anyone who might find it helpful. Welcome back to the NICUToday Podcast. Our guest today is Jaylee Hilliard. She is a seasoned neonatal nurse leader and two-time NICU mom, now serving as Vice President of Clinical Strategy at AngelEye Health, with over a decade of experience in neonatal and pediatric care, including as Director of Neonatal Services and Pediatric ECMO at McLane, Children's, Baylor, Scott, and White. Jaylee now leads a clinical innovation that strengthens family engagement, improves outcomes, and streamlines care through technology. She's also had a personal journey through the NICU with both of her daughters. I'll let her share more about her NICU experience, including a delivery during the height of the COVID-19 pandemic. She is passionate about bridging the gap between compassionate care and digital health solutions that keep families connected when it matters the most. Welcome to the NICUToday Podcast, Jaylee.
Thank you so much, Martha. I'm so happy to be here.
I am thrilled to have you here as a guest. I'm so glad our paths crossed and we met one another through various NICU connections, and so happy to have you here to share not only about your family story, but also about your career in healthcare. And I'm going to start there because you started as a nurse, right, in the NICU?
I did.
Tell us about your background in healthcare and kind of where it brought you today.
Sure, absolutely. Happy to do so. So I started out as a bedside nurse in the NICU. I knew I wanted to go into healthcare. Kind of in my teenage years, I was hospitalized and had an experience where I really was just kind of shown and highlighted what it looks like to receive really amazing, compassionate care when you're vulnerable and 17 and a teenager, and it just really left a lasting impression on me. So I knew I wanted to go into healthcare, and my best friend's dad was actually a NICU nurse. And I always heard him talk just about the amazing things that he experienced and how much he loved his career. And so although no one in my family was in healthcare whatsoever, I just kind of took a leap of faith, and I knew the NICU was where I wanted to go. So that's the only place I applied for an internship and was grateful to get accepted out of nursing school. I started out at a level 4, 51-bed NICU here in Central Texas. And that kind of started my career pretty early on. I found just a love and passion for the entire family unit and recognized that there was more than just a baby to care for throughout the NICU journey.
Well, so you started in the NICU, and then when did you transition into this role at AngelEye Health, or when did you kind of move in that direction?
Yeah, so I had that role in the NICU as a bedside nurse. I became a leader in the organization, went back as the director of that NICU. And then about 6 years ago, I decided to start a consulting company to really bridge the gap between healthcare and industry. And I had led what we called like a value analysis team for pediatric and neonatal care in my healthcare system. And so I had a lot of experience working with supply chain and various vendors to really make sure that patients and families were receiving the best care, whether that's with a medical device or software to support the care that we were delivering. And I noticed that there were opportunities or times where someone had a really cool idea or device, but they may not know how to articulate the value to us in healthcare. And so I really went out seeking a company with a mission that I could get behind and fall in love with, to help them better communicate and articulate what they do. And that's where I was connected with AngelEye Health. And again, just really fell in love with their mission to empower care teams and equip clinicians with the tools they need to help improve outcomes for babies.
Well, and I'm excited later in our conversation, we're going to talk a little bit more about AngelEye Health and resources that are available for families. And many of our listeners may have the AngelEye Health cameras in their NICU so that they can see their babies when they go home. Certainly not a technology we had during our time in the NICU. But so being in healthcare, you were a NICU nurse, director of a NICU, and then you had a NICU experience. What did that look like for you? Tell us about your journey of having a baby, starting a family, and ending up in the NICU.
Sure. So it wasn't until I had started consulting and left that previous role that I even met my husband, and had time to even spend, figuring out what does a family look like for me. So I met my husband. We got married kind of at the very, very beginning of the pandemic. We were older when we met. We knew that we wanted to start a family. I had a pretty normal pregnancy. I was just really nauseated every day, and that was not fun, but everything else was going according to plan, other than us joking around about how we were like, geriatric parents to a new baby. And so at my appointment, about 8 weeks prior to when I was due, my blood pressure was elevated, and that was just kind of a means to an end of the experience of being pregnant. So it was kind of before I'd had a baby shower, before I'd had maternity pictures or any of those things. I just went to an appointment and I ended up getting admitted so they could evaluate me. And then shortly after that, we ended up urgently having a C-section to deliver Everly at 32 weeks and 6 days in the same NICU that I had been a nurse and a leader previously. So that was a really crazy experience to be on the other side of the bed or the other side of the incubator, if you will, to go through that journey and experience. Because although I spent a lot of time in the NICU, going through all the OB services and going through the experience of being admitted to antepartum, not knowing how long I was going to be living at the hospital in the pandemic with one visitor, was completely terrifying and completely unknown to me.
So that is what I did want to ask you. When you were admitted to the hospital, did you spend time on bed rest?
I did. I thought that I was going to be there for several weeks. Like they were going to try to get me to 36 or 37 weeks. Here I was a little over 32 weeks. And I'm thinking, man, I'm about to figure out how to work from this hospital room. It was just really terrifying because at that point in the pandemic, you couldn't just come and go places. I had one visitor. I knew that probably should be my husband and that was the right thing to do. But another part of me like desperately really wanted my mom to be there. And I think a lot of people can probably resonate with like when you don't feel good or when something's wrong, like there's just this instinct in you that's like, I need my mom. I need my parent. That's my other support person. And so it was really, really difficult. My mom was the one that actually had gone with me to the OB appointment that day. And so I knew when I went to the hospital, I had to like make a choice, choose a person. And it just seemed so unfair. And I was just really caught off guard and felt, I think it made a really, uncertain time in my pregnancy just compounded the effects of how devastating it felt not to just lose all of those normal, exciting parts of pregnancy and delivery, but feeling incredibly alone and isolated and without your people, without your village and your support system. So that was really, really difficult, really hard. I don't know if it was fortunate or unfortunate, but I was only there for 3 days before Everly was born. So luckily I did not have to spend weeks and weeks because I can only imagine from like a mental health perspective what that would have done to me, to feel so isolated and alone there.
How did you, and I think the COVID-19 pandemic just added a completely different layer. I only was on bed rest for 5.5 days before Claire and Mary arrived, and my parents were there with Paul. Paul was trying to work. Mm-hmm. I was there, in complete bed rest back in that day. The challenge and the layering over of the COVID-19 pandemic, I can only imagine what kind of stress that put on top of you, and also, welcoming your new baby to the world. What did the NICU experience look like? So I also can only imagine being a nurse who has worked on the other side of the isolette. How did you work through that of having to be a parent versus being the medical provider
Yeah.
when your daughter was born?
That part is hard. In some ways, it felt like when I saw some of the familiar faces and heard familiar voices from the NICU, it almost felt like kind of coming home to me, because those are people that I knew and I trusted and respected and worked with. And I honestly spent more time in the NICU and at work than I ever did outside of work or outside of life when I was the director there. And so in some ways it felt very familiar, but the experience I was going through was completely foreign. And I think it was also compounded by, this was my very first baby. So I didn't know what to expect when I was getting a C-section, or if they were like, are you having contractions? I'm like, I don't even know what that's supposed to feel like. And so I think that, I don't know, it was difficult because I knew some of the things that were happening from being the bystander or the person that had been there previously to catch the baby from a C-section or to support the baby. But I did not know and understand all of the parts that involved supporting the mom. And I didn't appreciate, the medications, the sleeplessness, all of the tests and all the blood pressure, monitoring, and all of the things that happen that have you in this state of like severe sleep deprivation and not feeling yourself, and then feeling really anxious and worried about your baby. So I guess I would say it did help to have some familiar faces. It was scary to know all the things that could go wrong, and to want to know, like, okay, what are my baby's APGAR scores going to be? Are they going to come out, is she going to come out vigorous and breathing, or floppy and needing some emergency intervention? And so, or something in between. So that part was really hard. But in the moment, I was just so stressed and shocked, exhausted, and not feeling right. I had been on magnesium. And I did not feel like in my right mind at all. And so it was just kind of hazy, and it felt like a lot of things happening at once.
The magnesium piece is a whole other experience as well. While I did not go through that, I have many friends who have, and that is certainly, I know, difficult from talking with them, and a hard thing to kind of recover from. What do you think, when you look back at your admission in the NICU, what do you think was the biggest challenge for you, Jaylee?
That's a really good question. I think my biggest challenge for me was trying to figure out how to be and feel like a parent in an environment that I really quickly realized was not built with the concept or idea of the parent being like the center most important piece of the puzzle. And I don't say that because anyone intentionally did anything wrong or it was a terrible experience or anything like that, but just it became very clear to me that these principles around family-centered and family integrated care were not part of like the design of what things look like, or the culture and practices that not just are in my former NICU, but in NICUs around the country. And I immediately got it when I'd heard parents say before, like, I have to ask permission to pick up my baby. I have to, instead of feeling like the parent and biologically and physically, I felt like I need to go hold my baby. Like they should be skin to skin with me and I need to hold and protect my baby. This is probably going to make me cry, but my first experience going in and seeing my daughter after just seeing her briefly after a C-section was being told that the nurse was at lunch and I needed to wait until she came back to be able to hold my baby. And I know that doesn't sound like anybody intentionally was doing or saying anything wrong, but And previously, as a leader there, I probably wouldn't have seen anything wrong with it. But going through the part as a parent where like it had been hours since I had her, I had to get my blood pressure under control. I had to go to the bathroom. I had to get a wheelchair. I had to get all of these things in place just to make it to go like see and hold my baby. And then someone's just casually saying, oh yeah, you can't pick her up or hold her right now. You need to wait while someone eats. And I'm like, eat? Who needs to eat? Like, I just gave birth to my baby and they were like ripped out of me and they need me. And so I remember just kind of standing there holding her hand and just feeling really, really helpless. And like, this shouldn't be the first way that we're like reconnected after, me being pregnant with her for over 32 weeks.
Well, and I can only imagine. Thank you for sharing that. And
Yeah.
we always say you can cry anytime you want. But today is a good day. And with me, okay, big fan of crying over here. But I do think, and I know you're not in that medical field, but it definitely would have changed your way of managing on the floor, right?
Yeah.
Moving forward. And I oftentimes think about the experiences that NICU nurses or even neonatologists have when they go through the NICU themselves, how that really changes their perspective. My husband and I actually do a presentation on 5 key takeaways on the power of nursing. And we talk about a couple of different pivotal moments. And what you just said really falls in line with what we talk about. But there are these pivotal moments that certainly stick with you for years to come.
Yeah. I don't
Right?
think I'll ever be able to like think through that scenario or situation without it like instantly, like this instant gut wrenching feeling and reaction and way that I respond every time. And it's crazy because I've talked about it a lot, right? Like I feel very strongly about it. I want to help educate and be a part of a change, of a revolution, if you will, to do better for families and babies and help things start off just in a better way in general and be part of that solution. But yeah, it's amazing. It doesn't matter how many times I talk about it or who I'm talking to about it. It's just I just can go back there immediately in time. And she just had her 4th birthday. So it's not like this happened yesterday. So, but yeah, I'll never forget that. And my husband will never forget like the look on my face when I felt like I had to pause and take a moment to collect myself and figure out like, what is the appropriate way to respond in this situation that I didn't understand, felt so inhumane and so wrong until this moment when I was probably the nurse that said stuff like that to many families many times. And so I don't know. I remember listening to a speaker a long time ago that talked about these like crucible moments that you have in your life. And there's like ways that you can respond to them. And there's only a few that you have during your life, but I can tell you going in there and seeing Everly and not being able to just hold her or have someone embrace me like meeting her for the first time is definitely one of those moments for me.
Now, you mentioned your husband, Jaylee. How was his NICU experience, as much as you can share from his perspective and what you all went through?
Well, I'd love to get him on here to talk about it, but unlike me, it's like opposites attract, and he is very introverted and quiet when it comes to sharing things. But, his experience was very much like, I am going to sit back and observe everything. And he was like, I knew that if I saw you get worried about something, then I should be worried. But he was like, everything that was happening, he's like, I had no idea what was going on. He had been in hospitals very few times in his entire life. He hated hospitals, which made that, potential several week stay with him during the pandemic. Like that caused a lot of anxiety for him because he was like, I will do anything for us not to have to be in this hospital. Like it was very anxiety inducing for him to just be in that environment with healthcare professionals. And so he was already very anxious and on edge from that. And then just the every minute of every day, not knowing we have this plan, now we have that plan, was really hard for him. And then I know he said, like during the C-section, he was sitting next to me holding my hands, but I guess he was like a little too close to the curtain, and he was like, some of your insides were outside your body and there was so much blood. And he was like, I felt so lightheaded. And he was like, I just sat back like really far behind you, just thinking like, don't look over the curtain, don't look over the curtain. And then when she was born, he was like, I just wanted to stay out of everyone's way. And they were communicating with him and like, congratulations. And he's like, don't talk to me. Like, just save my daughter's life. Like, just keep my daughter alive. I'm just over here whenever you're done doing whatever you need to do. So I think they did a really great job engaging him and educating him on what was happening. But he was very much like, let me stay out of the way. And I remember him asking, like, do I stay with you? Do I go with the baby? And I'm like, you go with the baby. Don't leave the baby. And so he went with the baby and he sat and he watched as they were getting her settled. And his biggest memory is like, she just kept screaming at the top of her lungs. She just screamed the whole time. And I think that was reassuring to him to see how feisty she was and how much she screamed. Ella, fast forward to Ella, that we just had 9 months ago, her delivery, I don't know if you want to talk about that separately, but her delivery was completely opposite. She came out and made like one little screech, and she was 36 weeks. So she was like, she had much more time to cook, but she was not able to get steroids prior to delivery. And so I think that really impacted just how, premature her lungs were. But she made one little squeak and then was just floppy and not moving. And so Brian, in hindsight, was like, I have never been more scared in my entire life than I was when I saw the NICU team with Ella under the radiant warmer. And like, they were like, he was like, they were flicking her. They were doing like sternal rubs on her. And she was just laying there. And he was like, I just kept looking at the guy at the head of the bed that I figured was in charge of the show. And I was like, as long as he's not freaking out right now, I'm going to stay calm. But he was like, I really thought she was dead, or like that, like she was going to have a lot of help to live, to breathe. And so, but interestingly enough, he did not share this with me until like months after we've been home from the NICU, how terrifying that was for him. And he had that experience with Everly and thought like, okay, wash, rinse, repeat, right? And then it turned out being a totally different experience. We were there a much shorter time, but she had to be intubated. She needed surfactant. She had CPAP. And you could really see her struggling to breathe. And that was not an issue with Everly at all. She was just focused on feeding and growing and being lazy and wanting to sleep.
Mm-hmm. It's interesting to see how the experiences are so different, right?
Yeah. And the stay that was 25 days, in some ways, it was more isolating. It was during the pandemic. But I felt a little less worried about her than I did this very quick 5-day stay with my baby that's obviously in respiratory distress and really struggling.
So I did want to talk to you a little bit about your work with AngelEye Health, because you transitioned out of the NICU, you've been working with AngelEye Health. And the work that AngelEye Health does is really incredible, of providing the cameras in hospitals so that families can see their baby when they can't be bedside with their baby. And then there are a lot of other resources that are available for families through AngelEye Health as well, right? Even if you don't have the cameras there that you can access online. Can you talk to us a little bit about that?
Sure, absolutely. So you're absolutely right. About 11 years ago, AngelEye was founded. We have bedside cameras, so parents and an unlimited number of additional family members or support persons can log in and see the baby almost any time from anywhere around the world, which is an incredible way to stay connected. I actually did not have cameras 4 years ago with Everly, but was able to experience using the cameras as a parent 9 months ago with Ella, which was a really incredible experience for me to see personally what the difference was like having that connection. But to your point, we also have several other solutions. So we have our milk tracker solution, which is a feeding management software that helps ensure that the right baby gets the right milk or feeding and that it's prepared appropriately. And it really engages parents as part of the feeding plan for their child as well. So if you're pumping, there's ways to log that. You can see your data, trends, and analytics so that you can see your production and how it's impacted or influenced by different interventions and things that you're doing with your milk supply, which is really helpful. And you can actually log those sessions while you're viewing your baby on camera if there's cameras in your unit. So Milk Tracker is a great tool. And then we also have NICU to Home, which I've been speaking a lot about and working on that project for the last few years. There's over a decade of research on the impact of NICU to Home, and it really is the first evidence-based NICU navigation and discharge coordination solution for families. So it's able to provide, we have about 800 pieces of content available in more than 70 languages. So even if you're not at the bedside, even if you don't speak English, if you have a smart device and our app and your hospital is utilizing NICU to Home, we can give you unique information about your baby and about what to experience and what to anticipate from the day you're admitted through that baby's first year of life. And I think that's a real game changer, not just for parents or whoever the birthing parent is, but for people like my husband that might have had a different learning style or been processing things in a different way. He's totally a reader and he won't ask a lot of questions, but he would have been investigating and reading through articles and information that he would have put into play during his NICU journey if that type of technology were involved. And then the very last thing I'll mention is Edna, which is a neuromotor assessment tool that we have acquired and is pending FDA approval. And that is a mat that allows you to lay the baby on that mat for a few minutes and identify something called cramp synchronized movements, which are indicative of possibly some type of neuromotor condition. So for example, children with CP, sometimes they might go years without being diagnosed or being able to have early intervention. But Edna is a tool that will allow providers to know that more testing or assessment needs to be done to be able to figure out that diagnosis sooner and get intervention more quickly for patients. And then in addition to that, really the future for AngelEye is looking like embedding AI and some other sensors and analytics within our cameras to provide clinical insights and really aim to support that baby's outcomes and the clinical team just as much as we're supporting families.
I mean, do you just love all this technology?
I love it. I never considered myself a techie or have had really good skills, even like connecting my printer wirelessly to my computer. But here I work for a healthcare tech company. And it's just really, really incredible the number of brilliant people that we have on the team that are fueled by this incredible passion for making a difference for babies and families. Makes it the best place to come to work every day. I know there's, the quote about, love what you do and you'll never work a day in your life. And I feel that 100% at AngelEye, especially coming full circle as a NICU parent now myself. I initially fell in love with the company from my leadership experience and experience as a NICU nurse, but becoming a parent just really shed so much light on things like cameras, which have historically been viewed as a nice to have, or, oh yeah, that would be great if we just had extra money and just wanted to offer this to families. And now I look through this through a very different lens and think, man, if I can send my dog to doggy daycare and see him on a camera and get updates about him playing with his other dog friends, why am I unable to see what's going on with my baby that is in an intensive care unit when I'm unable to be at the bedside. And so that's just one example of kind of the advocacy and some of the work that we're doing to really make cameras at the bedside a standard of care, and then offering these additional solutions to really more holistically support families as a whole.
Love it. Love it. And last thing for you, how are your girls doing today?
They're great. Everly is 4 and thriving. She just had her dance recital last weekend. Loves dancing. She's sassy and has a lot of attitude. And Ella just started saying dada as her first word. I'm still a little bitter about it. But she's crawling all over the house. They're meeting their milestones, and we really couldn't be more blessed to have been in the right place at the right time and received really exceptional care so that they could be where they are today.
I love hearing that. Jaylee, thank you for being a part of the NICU Today podcast. Special thanks to our listeners for tuning in today. Jaylee Hilliard, NICU mom, NICU nurse, team member at AngelEye Health. Thanks for being on the show.
Thank you so much for having me, Martha. This was wonderful.
Thank you for tuning in to the NICU Today podcast, brought to you by Today is a Good Day. Learn more at todayisagooddday.org.